Welcome back to this now. The humanitarian crisis continues to worsen in the conflict-ridden Sudan. The United Nations is warning that the conflict is entering what it says is the deadlier phase as the fighting is now spreading to other areas. Unlike any other wars around the world, the Sudan conflict has not been widely reported on due to the hostile conditions for journalists. Now, for more insight on what is happening on the ground, I'm joined by Chenoa Sankar, an epidemiologist for MSF who was deployed in Sudan for 3 months this year. Thank you so much, Chenoa, for joining us and speaking to us this afternoon. Maybe just give us a first-hand perspective. I mean, a lot of what we are seeing coming out of Sudan is what we're seeing in the media, and it's not quite extensive, like I've just mentioned, that a lot of journalists aren't able to be on the ground. But as someone who's worked in that region, what did you make out of that 3 months that you were in Sudan?
Hi, good afternoon. So it is a very dire situation across the entire country. During the 3 months that I was there, I was based in Khartoum for 6 weeks and then in Blue Nile in the city of Damazin. Khartoum has been one of the major conflict zones throughout this war. And at the beginning of this year, the Sudanese armed forces recaptured the area, which meant that we've been seeing tens of thousands of people returning to Khartoum, a city where most of the infrastructure is no longer standing. So people were coming back home to, homes that have been destroyed and looted during the war, to very little infrastructure, limited access to food, water, and to healthcare services. Many of the health centers were destroyed during the war and are no longer operational. So MSF was supporting one of the larger teaching hospitals in the area. In Blue Nile State, we've been seeing a huge number of internally displaced people traveling across the border from South Sudan back into Sudan. So this was a very large population of people that were from Blue Nile State. And in 2011, when the conflict in South Kordofan started and spread to Blue Nile State, they were displaced, living in displacement camps in South Sudan. And now that the conflict has hit that region as well, they are starting to move back into Sudan, traveling for 2 to 3 months just to reach Damazin, where they are again living in settlement camps and in displacement camps with very limited access to health services and to basic necessities.
And who do you see being the most impacted by this humanitarian crisis?
So it is vulnerable populations. So particularly in Blue Nile State, we were seeing a huge number of under fives that were severe acute malnourished cases. We've been running a very big malnutrition program, about 250 bed capacity, and we've been seeing an increase in cases on the daily coming from different regions, but often trying to get to MSF facilities because of the free health service provisions.
What would you say really is the most underrated aspects of this human crisis that really the globe is not privy to, especially being someone who's on the ground?
So I think it's both the hardships that people are facing on a daily basis. So the way that they have to cope with the unpredictability and instability in that area and not knowing what's going to happen the next day, whether they're going to have food, whether they won't. So that daily hardship that they're facing every single day, just the struggle to get basic things like water. The women in Damazin were traveling for hours carrying 20 liters of water by themselves just to have enough water for the day or the next day for their families, spending 8 hours in the forests looking for firewood just for them to be able to cook one meal. And for some people and for that particular population that was coming from South Sudan, this has been their reality since 2011. So they spoke to us a lot, and the community spoke to us a lot about their children not knowing anything other than war and displacement.
You speak a lot about the damaged infrastructure and the lack of basic services that many of those communities don't have access to. How then do you monitor and control disease outbreaks in such an area?
So we don't have any sort of ongoing continuous surveillance. Most of it was destroyed during the war. So one of the methods that we use is a network of community health workers. So we rely a lot on the community and having continuous community engagement to understand what's happening within those displacement camps and within the general surrounding populations. And basically that continuous engagement sort of gives us an idea of what we might come across or any sort of signals for outbreaks. And then also for us, it's our health facilities. So we monitor quite closely all the patients that come through the different MSF facilities and the conditions that they come in with.
So, I mean, you worked there as an epidemiologist, and this is a very complex situation, I can believe, and therefore you can't employ the traditional ways of epidemiology. So, how innovative did you need to be in order for you to get the work done?
Yeah, so we have to continuously adapt our approaches and create strategies that are easily adaptable. So the context is continuously changing. In terms of our logistics and our operations, we always have to plan and prepare for us exceeding the capacity of a specific facility. So during things like cholera outbreaks, if we have to expand from what would be a 50-bed facility to 250, we have to make provisions for that, and we don't always have the space. So sometimes we have to be quite innovative and creative in our approach to try and treat patients. We also do try and decentralize the health system a little bit and create either like mobile clinics that we can deploy to certain areas if we're seeing a huge increase in cases, or sort of oral rehydration programs that we can put into place in different areas where we are seeing a lot of cases. So that's sort of the approach we try to take. We do also try, in terms of the outbreak response, try and understand what vaccination status looks like in certain populations so that we can try and preempt anything and we can try and address something before it happens.
And I can imagine that the cuts in the funding don't make your work any easy. How has this impacted MSF's work in how you're able to continue with your operations, especially with those health outcomes in those vulnerable communities?
So we've unfortunately seen the direct effects of this on the ground in a very big way. So especially in Damazin, when we're trying to address all of these different infectious disease risks, one of the most important things is the baseline nutrition level of the population. And when that's poor and you have a lot of malnutrition, then when you do see an outbreak, you see increased rates, increased mortality. So one of the things that we saw on the ground was that these displaced populations don't have access to a huge amount of aid. So the aid provision provided by WFP and other UN agencies is very limited. A lot of families complained to us that they were no longer being registered to receive the packages for those that were coming in after sort of April and May. And for a lot of the families, they said even those that are registered and are receiving on a monthly basis these aid packages are lasting their family 8 to 10 days, and they are eating only once a day. And for the remainder of the month, they're lucky if they manage to find food every 2 to 3 days. So they're resorting to a lot of different coping mechanisms to deal with this. And we spoke to a lot of the mothers whose children were admitted to our inpatient therapeutic feeding center, and they resort to different coping mechanisms when they have this sort of acute food shortage, and that involves prioritizing children that they need to feed, so the younger ones, and leaving the older children without food for days, and also the adults in the household. And for them, they also spoke about when a child comes into the malnutrition program and then once they're discharged, looking a bit better and feeling quite well, it's only a matter of time before they have to bring their child back, because we are essentially sending them back into the same situation where there's this very limited access to aid.
And do you think the international community is doing enough in assisting in this situation?
So I think based on how we were seeing the impact of these funding cuts on the ground and how direct it was, I think a lot more needs to be done to make up this difference. Until we're able to sort of increase the amount of aid we can provide, it might need to be that we encourage independent donations to our WFP and UN agencies so that we can resolve this discrepancy.
Yeah.
But the discrepancy is significant, so a lot more needs to be done.
If someone is sitting in South Africa and listening to this conversation and maybe perhaps not necessarily being able to relate with regards to what's happening in Sudan, when you were there, how has this shaped your own worldview? And what advice would you give to someone who's not in Sudan in terms of how then they would perceive what is happening there, even just from a place of empathy?
So I think it's for us as aid workers, it's very difficult to see people going through these struggles each day. You get to know the patients in the facilities. They start to tell you their stories. You start to understand more about what challenges they're facing on a daily basis. And for us to always have to say, there's only so much that we can do, it's incredibly difficult. And incredibly hard for us to continue to see them struggle. And for us, it's short-term missions. So we come in and we go out, and that's not our reality every day. And even for our national colleagues, for them, they've also struggled quite a bit by this conflict, but they continue to try and help their people, and they continue to try and support MSF and support the other NGOs in the region. And I think that it would be incredibly great if people could try to understand some of the realities on the ground, even from a distance, and to try and empathize with the situation that people are going through, and for that to hopefully bring about some change in terms of the amount of attention that this issue gets and the amount of support.
And any impact that you think would have on the surrounding communities? Is there a spillover from what you were able to see over that 3 months that could impact neighboring countries or even neighboring communities?
So yes, I think that there's going to be, there's still a substantial number of people that are moving. There's still a huge amount of internal displacement. And I think with all of this movement between the different regions, it's going to put pressure on existing systems as other systems collapse. And hopefully the Sudanese government is able to rebuild some of the systems so that it takes off some of the pressure. But I think, yes, even surrounding countries, there are going to be challenges. There are ongoing challenges in South Sudan, and that was why we were seeing this sort of movement again of people back into Sudan. And I think that that region, there's going to be sort of consequent effects on surrounding areas throughout this year and going forward.
All right. Thank you so much, Chenoa, for joining us and just sharing those experiences with us out of Sudan. That's Chenoa Sankar, who's an MSF epidemiologist, speaking to us about the impact of that war-torn area and the worsening humanitarian crisis in Sudan.